All right. Hi, everyone. My name is PJ, Preston Lee Jr. I am the Peer Recovery Program Coordinator for the Department of Behavioral Medicine and Psychiatry at WVU. And today we're going to be talking about peer recovery support specialists or PRSSs in the COPE program and the impact that we have on the patients. I want to talk about our peers are based out of the emergency department at Ruby and at Fairmont. So, as most of you may know, uh, initiated buprenorphine treatment uh, versus the brief intervention and referral, which is the SBIRT. Uh, with medication, it significantly increases engagement in addiction treatment, reduces self reported illicit opioid use, and decreases the use of inpatient addiction treatment services. It also increases, oh, sorry. It also increases retention and treatment at 30 days versus just a referral and then the brief intervention. There's a little chart for that. So, our peer recovery support specialists see patients in the ER to assist with advocacy, wellness planning, referral to treatment, and that includes outpatient MAT through our COPE clinic. We follow our patients through uh, any treatment process that they might engage in. We attend the outpatient BMed COPE groups to promote engagement in recovery and retention in treatment. And we work with patients on different levels in the hospital and treatment centers such as the DDU, 10 West, the Heart Vascular Institute, and as well as the Center for Hope and Healing. I also have with me today, I forgot to introduce him, William Tolin. He is our lead peer recovery support specialist uh, for the ED, and he's going to give his experience. He's a little under the weather today, so he's going to talk about his experience in being transitioning from a COPE patient into providing peer support and how peer support has helped him uh, get to the point that he's at in his life today.
Hello, everybody. I appreciate you having me. Thanks, PJ. I am a little under the weather, but I'm happy to participate. Yeah, so my program really didn't exist when I came through the ED. I came through the ED probably dozens of times in my life. This last time, though, I did. Our program wasn't quite set up yet, but there were peers in the ED, kind of like on a contract or kind of a temporary basis, and I was greeted. Um, by a peer who helped me. It was really a revolutionary kind of an experience for me for the first time in all the times that I've been through the hospital. It was somebody that I actually had grown up with, that I wasn't super aware had the same kind of problem throughout his life that I had had. But for the first time, I had somebody there that had he had gotten his life together. Had gone on to like pull himself up out of his addiction, and that's exactly where I was. He helped me get into sober living at that point in my life. I was homeless. I was sick. I had legal problems. I had health problems. I had nearly every kind of problem that you could have. But he helped me get into the recovery community. He helped me get into recovery housing, and really served to be an example of how to kind of overcome my problem. Um, and then one of the things that I had done that I think was also maybe step two of the things that were really different for me this time around was MAT. That was something I'd always declined, didn't think was for me. There was a lot of stigma attached to it. I kind of had this view that I don't know that I wanted this purity of being completely um, in a lot of places that um, that the best route to go. But I did get into the co clinic, and that provided for me kind of the stability and the attachment to other people in the recovery community um, that allowed me to kind of grow for the first time in decades. Um, and now I'm able to when I saw this position posted to work in ED, having had the experience that I had. I thought that that was quite an opportunity for me to be of service to other people that were coming up through the ED um, and trying to get their lives together. And that's kind of where I'm at today. And it's been a real pleasure to serve in this position. I've been here for almost 5 years. Um, 10 years ago to imagine that, that I would be a homeowner, that I would have all my kids, that I would have a job that I love, that I'm able to connect with folks that had the same kind of problem I had is it's just been amazing. And I've worked with hundreds of folks at this point, and I've seen it work for a lot of people.
Thank you, William. Wonderfully put. Yeah, William has been a pleasure to work with over the last several years. It's been fun to watch him do his thing and learn and grow alongside me and other folks. Uh, so what is a peer recovery support specialist? So a peer recovery support specialist, or a PRSS, is an individual in long-term recovery from substance use disorder who is authentically and actively engaged in a recovery pathway. They're individuals with personal lived experience with substance use disorder, treatment, and recovery, and specific training that uniquely qualifies them to provide guidance and support to help others initiate, maintain, and navigate the complexities of both treatment and recovery. And our role in the COPE clinic is to work with the provider, the therapist, and the case manager as part of the treatment team to help determine the best path forward for each of our patients. We attend the group therapy sessions along with the patients to help provide them support and guidance and encouragement. We also provide connections to various community resources, uh, the recovery community, and recovery support meetings. So we also serve as like resource brokers for our patients in the COPE clinic. And the types of support that we provide are they're really pretty varied. We provide that some emotional support, in being empathetic and having care and concern for our patients. Informational supports, and those are those connections and referrals to information and community resources that help support their health and wellness. Instrumental supports, those are things such as housing or employment. Affiliational supports, and those are connections to the recovery community, uh, sober activities and events that can uh, help provide them with a connection to their community in general. We also serve as advocates. Uh, we can be a voice for the voiceless. We serve as mentors. We provide that living example that recovery is real and that it can happen. We are fellow journeyers, because we are also people in recovery. We also serve as consultants in a way. We help them form and reach their recovery goals, help them develop their recovery plan and stay on track with that. We are listeners, and this is probably one of the most important things we do. We are listeners. We hear and understand, what they are going through, and we provide them with someone that they can talk to that they know has been through some similar things.
Hey, PJ, you had a question that was put in the chat. I don't know if you had seen it. I think it was for the
No, I
last
did not.
slide. Bruce Gorby had said, in a bind, can you collect urine drug screening?
I have, like we have PRSSs that work in sober living scenarios and inpatient treatment facilities that have collected uh, urine drug screens. Uh, we don't typically do it. They have MAs and stuff that handle that at our Coke clinic here in Morgantown. Right. So we don't necessarily do that here in the Coke clinic, but it's not out of the realm of possibility. So now we'll talk about the impact that we have on our patients. So for our impact PRSSs, our first appointment retention rate for COPE patients is 86% for those that are connected with a peer from our impact team. The fifth appointment retention rate is 66% for that same group of people. Whereas other modalities within our system, the first appointment retention rate is 76%, and the fifth appointment retention rate is 58%. So as you can see, this is the part where it shows that it greatly increases that retention in treatment and engagement, initial engagement in treatment. Uh, the further impacts that we have on our patients are being connected to peer recovery support services, reduces substance use. Studies show that individuals who utilize peer support experience 30 to 43% greater reduction in substance use and lower relapse rates than those relying on just standard care. It also helps reduce overdose rates. Studies also show that 34% decrease in overdose rates for individuals utilizing medications for opioid use disorder in combination with peer support. Once again, the better treatment retention. Peer supported individuals are more likely to stay in treatment programs and engage with outpatient care post discharge. Lower crisis unit utilization. There's a significant reduction in the emergency department readmissions, and they help reduce the reliance on acute care and inpatient services. Our patients show an increase in life skills because our PRSS has helped the individuals secure housing, manage their transportation needs, navigate employment, and reconnect with their communities. Our patients have also frequently report higher self-esteem, better stress coping mechanisms, and reduced isolation when they utilize peer support. Little typo there, but it's supposed to say it has increased psychological well-being for our patients. So, in summary, peer support is highly effective for substance use disorder by leveraging our shared lived experience, and it significantly reduces relapse rates, increases treatment retention, increasing the patient's self efficacy, and improving engagement with medical and other community services. And that all happens because we, as peers, are people who have already navigated these various scenarios. So we have that real world lived experience to be able to navigate, help our patients navigate through these things, because treatment and recovery are not easy. and it gives them someone that they can come to oftentimes when other providers aren't available, because we can work with them much more closely than traditional providers can. Meet them at recovery meetings, meet them at a coffee shop and discuss their recovery plan. In some instances, provide transportation for those individuals to treatment and to appointments, things of that nature. So we really do get to work with them a lot more closely than traditional helpers have in the past. All right. So lastly, I know this is not a super long presentation, but lastly, do we have any questions, comments, or concerns? Please feel free to ask any or share any thoughts or comments you may have.
I have a question. This is Jennifer Boyd from New River. Thank you both for the presentation and the interesting statistics as well as the story. My question is about after discharge from the ER with the prescription for buprenorphine. What has been your experience with how does the PRSS maintain, or does the PRSS maintain contact with that person, and how does that go?
So we maintain contact with them through phone calls, text messages. We can even do Zoom meetings with the individuals. We can meet with them in person. So there are various different ways that we stay in contact with those. From the ED to the Coke Clinic, we have impact slots that are set aside throughout the week to where we can get those patients an intake with folks like Tony Dikiakio and over at Chestnut Ridge on a much quicker basis than if they were to call and schedule their own appointment. They can come to the ED, they're not feeling well, they can get dosed in the ED, and then we can set them up with an appointment possibly the next day to get their intake underway. And then we stay in contact with them throughout that whole process and for just as long as they want us to be a part of their treatment or recovery.